What's up, everybody? Thank you for tuning in. I really do appreciate the time. Now, some of you have noticed, obviously, we're migrating away from YouTube for primary content. YouTube is kind of like a backup dumping ground because there's still people who follow on YouTube. But most of you already know that YouTube deletes most of my content. They censor most of it. They demonetized me several years ago. They forced me to delete, I think we were pretty close to 1,000 videos, several hundred at least. And that was the bait, right? You delete all of these videos, and then we'll go ahead and allow you to monetize your channel again, and you can go forward being really, really careful, like a lot of other YouTube creators are, where they say things, but they can't actually say things, so it's a lot of innuendo, because everybody is trying to run away from the YouTube censors. Well, I did that. I accommodated. After 3 years of not being monetized on YouTube, I'm like, all right, do I put any effort into YouTube again? Most of you know we used to do live streams on YouTube. They were really popular, got lots of views. I had a lot of videos that had, 20 and 30,000 views on it. Most of them weren't that popular, but I never used YouTube as a primary form of what I do. I'm a radio talk show host, and I would put videos up there for my audience. It wasn't designed to make money, and it wasn't designed to grow myself into a massive YouTube creator or anything like that. But as YouTube continued to just pick at it, and it would constantly hit me with these frivolous copyright claims, even though I had permission to use the music, or the music was mine, that was an interesting one. They continued to just, mess with me. And so for 3 years, I abandoned the YouTube channel, basically. Some of the stuff that went up there was kind of like an auto post from other websites that I had it set up to syndicate to YouTube and that sort of thing. And it was really just there for people who are already following me just to know that I was still around on YouTube, even though I wasn't actively really using it. So I wanted to clean it up. I was like, can I reclaim my YouTube channel? Do I delete it or do I reclaim it? So I tried to reclaim it. And YouTube wanted me to delete a bunch of videos. And so I went through and I was deleting all of these videos. We got pretty close to 1,000 videos. Pretty much, okay, this is essentially how it went. Pretty much every video, with the exception of a couple, that had like over 500 views had to be deleted. Everything, with the exception of one or two that were over 1,000, had to be deleted. They all had to be taken down. I tried putting them on privacy, and YouTube would still hit me with the notice that, nope, these still violate the terms, even though they're on private and they're not available to the public. So I deleted everything. And I got it down to where the only videos that are left are like ones that have like dozens of views or maybe a couple of hundred. I think there's a couple on there that maybe have like 1,000 or something like that. Basically, the only videos that were left were the ones that were unpopular or were really just a dumping, basically a dump video. It wasn't designed to be primary content or anything of that nature. So then I went ahead and I reapplied. I'm like, I did everything you guys asked. Here, go ahead and remonetize my channel. And what YouTube ended up doing is, because I had deleted all of those videos, which they wanted me to do, they then said that the number of hours that my channel had been watched no longer met the minimum threshold to be able to be monetized. So YouTube demonetized me several years ago, frivolously, consistently throttled my live stream, consistently took videos down. We would do a live stream from the radio station. We'd have, tons of views on it. And by the time I had uploaded the podcast after the show, half hour, 40 minutes after the show, the YouTube video was taken down for copyright violations, even though I had permission to use that music or it was my own music. Plus FCC licensed bumper music and that sort of thing. So that's a whole other ball game that YouTube doesn't play well with. So, I did what they wanted me to do to get control of my channel again. And then they basically said, well, not enough people have watched your channel. Well, enough people had watched my channel. You just forced me to delete those videos. And when I deleted those videos, YouTube took away all of those views from those videos from the metrics and now say that I don't qualify to be monetized. All right, whatever. YouTube's going to be YouTube. Everybody knows that YouTube censors and YouTube is terrible. So that's fine. Now I've moved over to Rumble. I do my live streams on Rumble. We were nomadic there for a little bit. We went to DLive. DLive was fantastic until BitTorrent bought DLive. The moment BitTorrent bought DLive, they became social justice warriors. They became the woke culture. They throttled my account. We were growing by, tons of people per stream. We were growing by 70 to 80 people per stream in new subscribers. It was generating revenue, which is something that I really wasn't doing the live stream for. And it was growing by leaps and bounds. And then they throttled it. And unlike other creators, they did not allow my channel to be discovered. They didn't allow me to earn money. They didn't allow people to subscribe to it. Even when I did non-political or non-news content, I was just playing Rocket League or something, they still wouldn't let me do it. So we left D Live. We tried Trovo. Trovo worked. Trovo is just a small community that's not doing anything. So, you know, most of the people who watched on YouTube or Facebook didn't follow us to D Live. We built an entirely new core audience on D Live, and a lot of them didn't follow us to Trovo, and now we're on Rumble. But the good news is with rumble.com/Casey the host, that's where you can subscribe. On Rumble, we have a viable YouTube alternative, and I'm a paying contributor there. I can do the live streams on Rumble. Most people can't right now. That will be rolled out for everybody in the future. So we're on Rumble. We're doing that, and it's great. It's fantastic. You need to come over to Rumble. But I also wanted to just take this opportunity to explain yet another reason why YouTube is so bad and why you should be following me on Rumble instead. So if you're a subscriber here on YouTube, one, thank you. I mean, I'm not saying to get rid of your subscription because you never know. I try to post things in multiple places. The way that I have it set up right now, what should happen is I should upload to Rumble. Rumble should feed YouTube, and YouTube should feed Odyssey. So you should have 3 places to be able to get my content. So if YouTube takes it down, the other 2 should have it, right? So I've built in that redundancy to make sure that I don't run into those same mistakes before where all of my content just disappears and nobody has access to it anymore. So I live stream on Rumble every single day at 3 p.m. Eastern. I do my radio show at 95.3 MNC, and I videotape it. And so while we're doing the radio show, you can watch the live stream. Rumble now archives the live stream. So that was a big complaint about Rumble before, but Rumble now archives those live streams. So when you do a live stream, just like YouTube, it converts into a normal video on your Rumble channel. But I did a segment not that long ago, and you can see this right here on the screen here. That's the notice that YouTube gave me the last video that they took down. But I did a live stream, my radio show, and during that segment on my radio show, I covered a new study. Now, this study had showcased what numerous other peer-reviewed studies had shown and what the white paper data clearly shows, which is that masks did not slow the spread of COVID. Now, that is scientific medical fact, okay? That's not anecdotal. That's not my opinion. That's nothing else. I've given you these studies. They're peer-reviewed. They're from esteemed institutions of learning and that sort of thing. And this one just happened to be from the University of Louisville. So we're not talking about Kyle's basement study or anything like that. This is all the actual medical scientific research. And I just did a segment on it. And said, basically, look, this one confirms this previous study that we talked about, and this previous study confirmed the other previous study that we talked about. Oh, and here's the white paper data that we have on all of this. And as we've been talking about with COVID and with the mask situation, there's this weird perversion that happened with masks. It started off normal when we thought it was droplet-based and not airborne. But it started off as, hey, look, a mask isn't really going to keep you from getting the virus. The idea is to keep the droplets in the mask so they don't spread to somebody else. That's the whole thing. But the moment you use a mask one time, you got to wash it or get rid of it. You have to. And nobody was doing that. And they got away from that message to just be, hey, buy any old t-shirt mask and wear it and you're going to be safe. And that's just not what the medical science shows. It's not what it's shown in any of the peer-reviewed data going back to 2009. Even the surgical masks, even the N95 masks, none of them prevent airborne spread of disease. Just a fact, okay? Most of the time the masks are because of bacteria and that sort of thing. That's not me saying that. That is the actual medical scientific research, and it's universal. There isn't a study that shows otherwise, and that's the issue. So when yet another study comes out and says, oh, by the way, mask mandates didn't reduce the spread of COVID, and it's out of the University of Louisville, and I do a radio topic on it, that's an important bit of information. But YouTube didn't think so. YouTube didn't want you to know that. So YouTube took my video down for, the quote here is medical misinformation, which is 100% a lie. That's all there is to it. It's a lie, just like most of the stuff that social media has been doing when it comes to the pandemic especially, but also politics and everything else. It's purely based on their own personal opinions. It's not based on medical fact. It's not based on scientific fact. It's not based on any of that. Friendly reminder, Facebook was the one that was out there banning people and suspending people and taking content down because you were promoting wearing masks early in the pandemic. And now Facebook has taken the complete opposite approach, where if you show any medical research, they fact check you or they take your post down and that sort of thing. And YouTube is basically in that same genre. So a University of Louisville study comes out and says, here, let me just show you here. No, that is the wrong one. My apologies. Here, let's do this. There we go. So masks didn't slow COVID spread according to a new study. Now, this is townhall.com, okay? So that's a partisan source, all right? But, essentially, new findings reported in the University of Louisville study challenge what has been the prevailing belief that mask mandates are necessary to slow the spread of the Wuhan coronavirus. The study notes that 80% of U.S. states mandated masks during the COVID-19 pandemic, and while mandates induced greater mask compliance, which they did not predict lower growth rates when community spread was low or high. Among other things, the study conducted using data from the CDC covering multiple seasons reports that mask mandates and use are not associated with lower SARS-CoV-2 spread among U.S. states. Now, I'm doing a topic on a news talk radio station where I'm covering this new study from the University of Louisville. Now, here's the actual study, which is published. Okay, you can see they got Yale up there and everything else, MedRx, and they go through the background. They've got the full text here, which you can read and go over. We're not going to do that right now. They got the metrics, they got the downloadable PDF and everything else. They tell you who's responsible. Just for the record, they did declare they have no competing interest here, which is good. You don't want them to have a competing interest. So if they have investments in a mask company and they would make money by selling masks and that sort of thing, they would have to declare that there, although some scientists don't. So anyway, they go through the methods and they go through the results. And the conclusions are mask mandates, okay, and use are not associated with slower state-level COVID-19 spread during COVID-19 growth surges. Containment requires future research and implementation of existing efficacious strategies. All right, cool. That's a pretty good study. Now, what they did is something that I did in August of 2020. Now, in August of 2020, we had an article from the Associated Press. This is from this is a note sheet that I had for a Pass the Mic event in August of 2020, okay? And the Associated Press at that time, remember, we hadn't hit that last surge. At this time, COVID cases are going down. And the Associated Press, what they did is they basically ran these headlines and said the mask mandates and wearing a mask are the reason that COVID is now going away. All right. My response at that time was, why is it that would be the case only in the United States and not be the case anywhere else in the world? Because what was happening at the time that the Associated Press was saying this is there were spikes in Japan, there were spikes in Germany, there were spikes in Venezuela, South Korea, and all over the world. But those places had mask mandates in place for an extended period of time. Japan was one of the first places that had one. I mean, they go back to 2019, they had a mask mandate. They heard that there was some kind of a disease over in China. They all masked up. And in Japan, they have a near 100% mask compliance, right? So if that is the case, if the mask, this is the Associated Press's position back in August of 2020. You can see that the last edit on this was August 28th. Why is it that Japan was having a spike at the same time that the Associated Press was saying mask mandates were the reason COVID was going away, when Japan had a higher compliance and they had the mask mandate for a longer period of time? Why was it that they were having an increase in COVID cases? If the masks were doing what was being alleged by U.S. media and not by the real medical community, why is it that wasn't showing up anywhere else in the world? And at the time I was doing this Pass the Mic event, I had hypothesized, I said I wouldn't be surprised if Fauci was right about a fall surge because we're seeing it in all of these other countries now. It would make sense that we would have another one coming up here at the end of summer. And again, August 28th, this is the last edit. You can see that right there at the very top. You can see it. It's right there. So I'm not lying to you, right? Not that I have any reason to lie to you. And at the time also here in Indiana, what we had is we had Governor Holcomb running around basically saying, my mask mandate is the reason that COVID is going away, and raw me, and screw all of you people who didn't want to wear a mask. I was right. You were wrong. Haha, we beat COVID. And then, of course, we know what happened. It's September. We already know. United States got hit with its other surge, and so did the rest of the world. Now, what I always found interesting about that, if you look at the Yahoo News tracker data, at the time that we were low, so August of 2020, at the time that we were low on cases and declining, it was roughly like 80, I might be off by a couple of percentage points here, okay? But it was like 80, 81, 82% of Americans were complying with the mask mandates and wearing a mask in accordance with the guidance, okay, that the government was giving. And they were doing that as the numbers were hitting bottom. And then they were still wearing masks in the exact same numbers according to the tracking data when the surge started. And then in the middle of the surge, more Americans were wearing masks than had ever worn masks before in accordance with the guidance that they were getting. And the numbers continued to climb. So I was always telling people on my show, it's like, look, masks have a place. It's just that this mythology that a mask is somehow, some way, the most effective form of protection against COVID, when the reality is it's your last ditch effort when all else has failed. It's the least effective way to keep you safe from COVID. That's the fact. And early on, they were telling you that. That's the good thing. They were telling you that that was the case. They were telling you needed to wash or recycle your mask. You had to do that. And they got away from it. And it purely became a virtue signaling propaganda campaign about wearing a mask. We've gone over the World Health Organization, refusing medical doctors to classify COVID as airborne. The CDC classified COVID as airborne, and the World Health Organization called them that afternoon and said, please take that down. The CDC did. They took it down. And then now, just a few weeks ago, the CDC finally did admit, yeah, it's airborne. And the reason, my theory is, now this is just a guess, my theory is the reason that they did that was once you admit that the virus is airborne, you're admitting that the masks don't work. Mask cloth even can work in a limited capacity, very short period of time with a droplet-based virus. But if the virus is airborne, masks are useless. It doesn't matter if it's a cloth mask, it doesn't matter if it's a surgical mask, and it doesn't matter if it's an N95 mask. If you've listened to my show for any length of time, I have given you every published peer-reviewed study on this going back to 2009. They all say the same thing. Masks, surgical or N95, do not prevent the spread of airborne viruses or coronaviruses. Specifically, influenza and coronaviruses are where they study this the most. In a sterile hospital environment, they don't prevent the spread. There's been studies done on cloth masks, which find, cloth masks do cause upper respiratory infection if they're not properly cared for, and most people are not properly caring for their masks. That's all on the CDC's website. That's all at the NIH. That's all in the WHO. These are all in these medical journals. And all I have ever done is quoted the actual scientific research. When I tell you something is my opinion or guess, I will tell you, just like I've done a couple of times already in this video. But what I found so interesting about this is while this was happening back in August, and we were going over the white paper data. So I wrote this, I wrote this down just to talk to my audience about when I was doing Pass the Mic. This, again, August 28th was the last edit on this. Germany currently has a spike. Mask mandate was in effect from April 22nd. France had a spike. Mandate was May 10th. Italy had a spike, which topped their 1,000 cases a day for the first time since May. And their mask mandate went into effect August 16th. Now, keep in mind, this is all 2020 data. This is not 2021. South Korea had a spike with over 15 days straight of triple-digit increases. The mandate was in effect on May 26th. The entire Western world, I pulled up headlines on this. The entire Western world was saying South Korea was the model to watch because South Korea beat COVID. And we all needed to emulate South Korea. Well, South Korea had a mask mandate May 26th, but most people were wearing masks anyway before then. But the actual mandate went in place there. And while we had news articles in the United States, we need to do what South Korea is doing. We need to do what Japan is doing. New York Times had a whole glowing piece about Japan and how they, and I'm quoting them now, beat COVID. Well, they were all attributed to masks. Everything. They weren't attributed to staying home. They weren't attributed to sanitizing surfaces or washing hands. They were all attributed to masks. Every single U.S. media article was attributing that to masks. Well, if that was the case and masks were the reason that South Korea and Japan were beating COVID, then why did they have these spikes in August of 2020 when they had had the mask mandates for months and the masks were working and it was just one of those things that was very frustrating for me where it's like, look, anybody who's willing to at least look at this honestly will take a step back and say, all right, they're telling us that masks reduce the spread of COVID. And that's exactly what they said throughout this entire thing. And they're still saying it now with vaccinated people. Masks will prevent the spread of COVID. Okay, then why hasn't that materialized in any country on Earth? That was the big question that I'd asked. And anybody who's willing to at least look at the data would go, well, you got a point. You've got a point. Now, there's some other theories as to, why perhaps, these masks didn't do it, or there's even a theory that's floating around in Europe on whether or not people not cleaning their masks may have been contributing to the spread of COVID. And again, that's all preliminary hypotheses, and they're studying it now and they're looking at it. But, the reality of the situation is, Fauci said this too. Fauci said early on, look, you get the mask, you get COVID on it, and you're touching it with your hands, and now you're spreading COVID everywhere. Right. And since most people don't wash their masks or sanitize their masks, now I do. I probably do it more than most of the people out there in this audience, and I still ended up with COVID. So it's important that when you're looking at this, and I understand that there's censorship, and this video is probably going to be taken down too. So just do yourself a favor. If you're on YouTube, just go to rumble.com/KC the host and subscribe over there, because I've already uploaded this video to Rumble, and then it fed to YouTube, and then YouTube fed it to Odyssey. So you at least have it on Rumble and Odyssey, because I am willing to bet money that YouTube takes this down, even though I'm just explaining why YouTube censored me. And all I did was give you what the experts said at the University of Louisville when they looked at this data. And this data from the University of Louisville study is not new. It's not unique. There are previous studies that did this. Anybody who went back in time and looked at mask mandates and COVID spread, not just in the United States, not just in individual states in the United States, but everywhere in the world, will see that mask mandates did not cause a reduction in COVID infections. It didn't cause a reduction in deaths. It didn't cause a reduction in hospitalizations. It didn't cause a reduction in the spread of COVID, period, end of story. That's what all of the data says. There isn't a single speck of data that says otherwise. There was one study that was going to be published, and it was to come out again in August, and it was the one that said, hey, look, mask mandates, and we have a reduction in COVID cases. They retracted the study because in September we got the spike. And they said, look, our study, and there was the only one that was done that said that mask mandates would reduce COVID. And they had to retract it because obviously their data wasn't right. And it wasn't because they were wrong. They were looking at the data of when mask mandates went into effect in the United States and various states, and then what the number of COVID cases was per capita. And they were looking at that. Now, at the time, just like the Associated Press, various governors like Governor Holcomb in Indiana were crediting mask mandates for reducing COVID. They came to the same determination. Well, that all changed in September when we found out that that wasn't the case. And there was no change in, this is the other thing that people float out there, there was no change in the number of Americans who were wearing masks. The same number of Americans, according to the tracking data with Yahoo News, the same number of Americans were wearing masks when cases were low as when we got that last surge in September. And in fact, through the surge, more Americans than ever had worn masks, and it still wasn't slowing the spread of COVID. So all of the data, just the real world data, okay, says, so like if we had multiple studies that said masks work, but the real world data showed it didn't work, you have to take the real world data over the lab test. There's something the lab test missed if the real world data is completely opposite of what the lab tests show. But in this case, when we're talking about this issue, the studies, the lab data, the white papers, all of that coincides with the real world data. And the University of Louisville is not the first one to come up with this. This has been the case for over a year. All of the evidence suggesting that masks reduced or slowed the spread of COVID, it doesn't exist. There is no data that shows that. It all says the opposite. It all says that masks didn't. Now, some people, again, have speculated, well, maybe the masks actually increased the spread. I don't know. Okay, that's a theory. Epidemiologists have posited that. I know the top guy in Sweden has said that he wants to look at that. And there's various theories on how potentially that could have happened, if it happened. But, for right now, what we do know is we know that mask mandates and people wearing masks didn't slow the spread of COVID, and it didn't reduce the number of people infected. It didn't reduce the number of people who died or who had serious conditions, were hospitalized. That's all there is to it. So when the University of Louisville comes out with this, And I just tell the audience, hey, there's yet another study, because it's not the first. There's yet another study that tells you what I told you in August of 2020, that wearing a mask doesn't reduce the spread of COVID. That data is universal all over the world. It doesn't matter what YouTube says. It doesn't matter what Facebook says. It doesn't matter what Google says. It doesn't matter what some pundit on some cable news show says. The reality of the situation is that is the fact. And when I was talking with the mayor of Elkhart about this, and we got into an argument over it, I kept asking him a very simple question. Why is it that I have to listen to local health officials who say that the mask is the most important thing that you can do, when all of these other prestigious infectious disease experts all over the U.S. and all over the world, they all say that, no, that's not what's happening. Masks are not at all. They're your last-ditch effort. And for the record, the ones who were saying the masks weren't all that effective were still telling you to wear them, because there was an outlier chance it could protect you, right? But it was an outlier. It wasn't the most important thing. Masks were the least effective thing for COVID. And I kept asking him, I'm like, we have all of this data. All of the data shows this. Every single place on earth that has had a mask mandate has had an increase in cases. They haven't had a reduction. Why is that? And he didn't have an answer. He didn't, Mayor Robertson didn't have an answer. His response was, my health officials tell me that that's not true. Okay, but that's what the data is. And so when I do a segment on my radio show, which is licensed by the FCC and is broadcast all over Michiana, so parts of Michigan and Indiana, and all I'm doing is quoting a study from the University of Louisville, which corroborates previous studies, and I threw in there the information that I had given, this is all real world data, which you can get from any of the COVID trackers that were out there, including the official ones that the WHO were running. All of this data was publicly available, and I always found it very astounding that people just would not look at it. So YouTube took my information down, my video down, which is just of that segment, by the way. They took it down. I'll just leave this up there because maybe somebody will see the thumbnail and realize I'm just talking about a real study. And by the way, this has not been peer-reviewed, okay? Because, peer review is the most important thing out there, all right? If something hasn't been peer-reviewed, you got to take it with a grain of salt. And again, this is a preprint. This is not peer-reviewed. I want to make that crystal clear, just in case anybody was curious about it. So there are other studies, though. This corroborates previous studies, which corroborates the white paper data, which corroborates the data set that we have internationally, which is that, hey, everywhere that had a mask mandate did not have a reduction in COVID cases. They all had an increase. Was the mask responsible for that? Maybe, maybe not. Probably not. But what we do know is the mask didn't reduce the number of cases. And in the United States in particular, we know that there wasn't a reduction in Americans who were wearing masks. They continued to wear masks in the exact same percentage of population. And then during the surge in September, more of them wore masks, and it still didn't slow the spread of COVID. So we know from real world experience that the mask mandates did not reduce the spread of COVID. We know that they didn't slow the spread of COVID. We also know this when the DOD did their whole military quarantine study on it. We already know that, which it's sad, but the reality is that, and I'm not telling anybody not to wear a mask. Wear a mask if you want. I don't really care. There are other people that don't want you to because it's virtue signaling, and it is, and it's not all that effective, and it doesn't make a lot of sense if you're vaccinated to be wearing one. Okay, those are all fine. But again, I believe in freedom. If you want to wear a mask by all means, whether you're vaccinated or not. Just don't be bitching and moaning at other people for not doing it, because it doesn't make any sense. Your argument doesn't come from a position of validity. It doesn't come from a position of science. It doesn't come from a position of medical data. That's the issue. But if you want to, if it makes you feel more comfortable and you think you're more safe that way, please wear it. Whatever. That's fine. I don't care. I don't think anybody should harass you for wearing one, just like I don't think anybody should harass anybody for not wearing one. But let's not pretend that the facts and the data aren't the facts and the data. And the facts and the data, going back to 2009 with every peer-reviewed study, are that masks are not going to do what they're telling you to do. And there is no data that exists throughout this pandemic that suggests that masks are doing what they're telling you masks will do in protecting people. It just doesn't exist. And when you can't even go on your FCC licensed radio show and mention the peer-reviewed research along with this study from the University of Louisville, which corroborates previous research, which corroborates all of the data that I was releasing to the audience, which is all a part of the CDC and WHO's COVID trackers and everything else in August of 2020 about global spread. If you can't give people accurate data on what's really happening, then people aren't going to be informed and they're going to be easily manipulated, which is ultimately what YouTube wants to do. YouTube wants to control your behavior. YouTube wants to control what you digest, and that's the problem. It's just another reason to leave YouTube. Now, Rumble is where we've landed. We've tried a couple of other platforms, and some are better than others, but Rumble at this point in time is by far and away the best. And I would encourage you to go to rumble.com/Casey the host. We do the live stream of the radio show every day at 3 p.m. You can watch the live stream on my website if you really want to at theburningtruth.us. You can do that. We import the video into the live stream tab on my website. But, please go to rumble.com/Casey the host. Hit that subscribe button and make sure that you join the channel and come hang out with us, 3 to 6 every weekday. I would appreciate it. We also upload other videos just like a YouTube channel, because I don't think that YouTube is going to keep this up here either. But at least now you know why YouTube took down the last video and what it was about, for those of you who are watching this. And it was purely me doing a segment where I was quoting the experts. I was quoting the medical research. I was quoting the science. And YouTube didn't want you to hear any of it. All right, if you're on YouTube, again, I encourage you to go to rumble.com/Casey the host if you're watching this on YouTube. But if you're on YouTube, hit that subscribe button too. I would love to grow the YouTube channel also. I would love to have a simultaneous growth, but Rumble is the primary spot where I'm going to upload videos. YouTube is essentially where most of the audience is, and so I'm going to have videos still go there, hoping to capture some of those people and maybe bring them over to Rumble, but rumble.com is going to be the best place to get a hold of me when it comes to video content and to watch the live streams. All right. Thank you very much for watching. I really do appreciate it. And all of you, take care. Have a wonderful evening and be safe.